Welcome back to our channel. Today, we're diving into a topic that's vital for anyone living with kidney disease and undergoing dialysis: phosphorus. Why does it matter so much? How does it affect your body? And what can you do to manage it better? Let's break it down. Phosphorus is a mineral found in many foods, especially proteins and processed items. In healthy kidneys, phosphorus is filtered out naturally. But when kidneys fail, phosphorus builds up in the blood. High phosphorus can cause weak bones, itchy skin, muscle cramps, and even increase the risk of heart disease. And if phosphorus drops severely, the consequences can be life-threatening, leading to heart or respiratory failure, seizures, and even coma. The symptoms differ in intensity, but may include reduced appetite, changes in bone structure, and a weakened immune response. That's why dialysis patients need to pay close attention to phosphorus intake. To better understand the challenges patients face, let's look at a recent study. Published in the journal Nutrients in 2024, researchers Schneider, Klug, and Andrade investigated the dietary phosphorus knowledge of US adults on dialysis. Their goal was to pinpoint the exact gaps in understanding that lead to high phosphorus levels, even in patients who are trying to be careful. What they uncovered was striking and has significant implications for how we approach patient care. The study found that a vast majority of patients had critically limited knowledge about phosphorus in their diet. For instance, when shown a list of common grocery items, a significant number of participants couldn't correctly identify which ones contained high levels of phosphate additives. This wasn't about a lack of effort, it was about a lack of specific practical information. The biggest culprit? Processed and ultra-processed foods. The researchers highlighted that inorganic phosphate additives, things like sodium phosphate or phosphoric acid, were a major hidden source. These are added for preservation, texture, and flavor, but they aren't always obvious on the front of the package, turning everyday foods into phosphorus traps. Alarmingly, even when patients believed they were making healthy choices, they often consumed far more phosphorus than recommended. A patient might choose a chicken breast, not realizing the broth it's injected with contains phosphate additives. This disconnect between perceived healthiness and actual phosphorus content is a huge barrier to effective dietary management. The study's conclusion is powerful. Education isn't just a helpful supplement, it is a core component of treatment itself. Providing patients with the tools to read labels and understand additives is just as crucial as prescribing phosphate binders or dialysis. Without this knowledge, patients are fighting a battle with one hand tied behind their back. Phosphorus hides in everyday foods. Here's where you'll find it: high natural sources, dairy, beans, nuts, meats, fish. Hidden sources, processed foods, sodas, fast food, and anything with phosphate additives. The tricky part? Additives are absorbed more easily by the body, meaning they raise phosphorus levels faster than natural sources. Dialysis helps remove phosphorus, but it's not enough on its own. Patients often need dietary changes to limit phosphorus intake. Phosphate binders prescribed by doctors. Education to recognize hidden phosphorus in food labels. The study emphasizes that knowledge gaps can make management harder. Patients who understand phosphorus sources are more likely to succeed in keeping levels safe. Taking control of your phosphorus levels can feel overwhelming, but it's one of the most powerful ways you can protect your long-term health. Let's break it down into manageable, practical steps you can start using today. Think of this as your personal action plan for success. First, become a detective at the grocery store. Read food labels carefully. Your target is the ingredients list. Look for any word containing phos, like phosphate or phosphoric acid. These are inorganic phosphorus additives that your body absorbs almost completely. They're often hidden in processed meats, baked goods, dark colas, and instant puddings. Second, choose fresh, unprocessed foods whenever possible. This is where simple swaps make a huge difference. For example, instead of processed cheese slices on your sandwich, opt for a smaller amount of natural Swiss cheese. Swap a pre-packaged frozen dinner for a simple meal of grilled chicken, white rice, and green beans. These small changes significantly lower your phosphorus load. Third, you are not alone in this. Work closely with your renal dietitian. They are your expert partner in navigating the tricky balance between getting enough protein to stay strong and keeping phosphorus levels in check. They can create a personalized plan that fits your lifestyle and food preferences, making the diet feel less restrictive and more achievable. Fourth, never skip your phosphate binders. Think of them as magnets that grab onto phosphorus from your food right in your gut, preventing it from entering your bloodstream. For them to work, timing is everything. You must take them with your meals, ideally within the first few bites. They are a critical part of your treatment lifeline. Finally, ask questions. Knowledge is power. The more you understand about your condition, your labs, and your treatment, the more confident and capable you become in managing your health journey. Your doctor will monitor your progress through regular monthly lab tests. For most dialysis patients, the goal is to keep your phosphorus level between 3.0 and 5.5 milligrams per deciliter. Hitting this target is a major victory for your bone and heart health. So let's bring it all together. We've seen how phosphorus, a mineral that's in so many foods, can silently build up and pose significant risks to your bone and heart health when you're on dialysis. This isn't just about numbers on a lab report, it's about your quality of life. The study we discussed highlights a critical gap. Many patients feel uncertain about how to manage it effectively, but it also proves that with targeted education, you can absolutely take control. This journey is about transforming that uncertainty into confidence. Remember the practical tools we covered: reading labels for hidden phosphates, choosing fresh over processed foods, and timing your binders correctly with every meal. Each small choice is a decisive step toward protecting your body. Knowledge is your best defense, and you now have the foundational understanding to make informed decisions every single day. You are the most essential member of your healthcare team. Please remember, this video is for educational purposes and should not replace advice from your medical team. Always consult with your nephrologist and renal dietitian to create a plan that is tailored specifically to your health needs. If you found this information valuable, please hit that like button, subscribe for more in-depth kidney health content, and share this video with a fellow patient, caregiver, or family member. Dialysis is a journey, not a destination, and with the proper support, you can navigate it with strength and hope.